Post-bariatric surgery is basically the skin removal surgery after the bariatric surgery, which is like gastric sleeve or weight loss operations. After the amount of weight loss, there will be some skin saggings all over the body, such as arm, thigh region, or abdominal region, or breast. So in post-bariatric surgery, what we do is to get rid of that excessive skin tissue and to lift those organs and tissues, like arm lifting, abdominoplasty, or breast lifting. So this is what we call post-bariatric surgery. First of all, the general health status must be good in those patients when we select. The patient's weight loss should be stopped and the person shouldn't be giving more weight, and the weight must be stable so that we can do a good operation. For example, in a patient who is still losing some weight, after we do a breast lifting, for example, the breast will still change its shape after the operation. So it's not good for us. The best here is to stop the weight loss and decide the operation in that way. Post-bariatric surgery includes almost every region where includes skin, like arms, breast, stomach, abdominal region, the flanks, the back area, the gluteal area, the buttocks, the thighs. Everywhere which has abundant skin after the bariatric surgery or after weight loss are prone to post-bariatric surgery. In post-bariatric surgery, the surgical technique that we basically use is to cut the abundant skin, and we tighten that skin with the help of other technological instruments such as radiofrequency or ultrasound energy and so on, so that we can combine the traditional surgical techniques with the technological new innovations so that we can get the best results that we can. The duration of the operations depend on the combination of these procedures. For example, if we just do an abdominoplasty, it will take 3.5 hours. But if we add something like breast lifting, it's going to be 6 to 7 hours. And in general, we are not exceeding the time of 7 hours in our surgeries, because when the operation time exceeds some certain amount of time, so we have a safety concern. So as a plastic surgeon, I try to keep my operations under 7 hours and do my post-bariatric combinations according to this safety period. After the post-bariatric operations like arm lifting, breast lifting, or abdominoplasty or thigh lifting, we usually have a hospital stay of 1 to 2 days, and in some conditions it may be up to 3 days. And after this time, we add another 1 week on the hospital stay, and that's the amount of days that the patient must stay here in Istanbul. The duration about recovery after the post-bariatric surgery depends on the patient status, the age, and which regions that we operated on. For example, an arm lift will heal better than a thigh lift. So the movement of that tissue, the frequency of using that tissue, all these affect the healing and recovery period about the operation. So the chronic diseases that the patient has, also smoking, nutrition habits, all these kind of things affect this healing period. But usually when we have our patients in our country and have the operation, we usually send them home in a safe way in between 1 week to 10 days.